Um, I'm Nancy Aries, the interim dean of the Marxe School, and pleased to welcome you today to this panel discussion about abortion access and women's rights after Dobbs. It's being co-sponsored with the Cuny Institute for Demographic Research. So just a month ago, we came together to discuss Title IX and its promises fulfilled and the pathways ahead. Today, we find ourselves in an entirely different situation. The Supreme Court overturned a right upon which reproductive health care was premised for almost 50 years. And for many, the leak in the Dobbs decision was depleting in scope, but expected given the composition of the Supreme Court. For others, it was shocking that a right that was assumed to be secure was not. And my daughter, who's 35, said, "Mom, you always told me that Roe might be overturned, but it hadn't happened, and I stopped worrying about it." Our speakers today bring together a range of perspectives, and rather than read their formal biographies, which we will put in the chat, I wanted to share some of the reasons that we've invited them here, as they each have addressed issues that the overturning of Roe will impact as state laws criminalize not only the act of abortion, but medical advice and assistance as well. So, in no particular order, Ted Joyce is a professor of economics here at Baruch College in the Graduate Center. He's published widely on reproductive health policy. What I want to highlight is work on the impacts of law and regulations regarding parental notification with abortion. Beginning with a study about the parental notification statute in Texas in 2000, Professor Joyce's recent article in Demography looked at 37 state enforcements of laws requiring parental involvement. Also in 2011, he made the observation that restricting access to abortion had via access had little impact on the demand for abortions. He expected opponents would turn to supply side restrictions, which is where we find ourselves today. Laura Lindberg is a professor at the Rutgers School of Public Health, very recently appointed, where she directs the program in sexual and reproductive health, having worked as a research scientist at the Guttmacher Institute for over 20 years. She's also a founding member of Youth Reproductive Equity, a collaborative promoting equity and abortion access for young people, which I hope she has an opportunity to talk more about with us today. And I found her work on reproductive health education of critical importance. It's the underpinning of reproductive health. And in a recent publication, she's documented the decline in formal instruction about birth control and abstinence, having found that less than half of adolescents receive sex education that meets the minimum standard articulated in national goals. And while we regret that Pravaja Kavatur, a research and program associate at the National Advocates for Pregnant Women, cannot join us today as originally publicized, we're joined instead by Dana Sussman, the acting executive director of NAPW. Dana is a lawyer, holds an MPH. She previously served as the Deputy Commissioner of Policy and Intergovernmental Affairs at New York City Commission on Human Rights, where her responsibilities included the Commissioner's gender justice policy portfolio. At NAPW, she oversees the organization's work related to legal advocacy, public education, and organizing. The work at NAPW is grounded in sound research and programs directed at protecting pregnant women. Finally, our moderator is Sonia Jarvis, a distinguished lecturer at the Marxe School of Public and International Affairs. Her scholarship and teaching focuses on race, politics, and media. We've invited Professor Jarvis to moderate this panel, given her deep knowledge of the judicial law on racial inequality. She was invited to moderate as all policy is framed with the legal constructs of this nation, and that is the perspective she can add to the discussion. So before turning over the Zoom podium to Professor Jarvis, I want to point out that during the session, we will leave cameras on, but your audio is off. So please enter your questions into the chat and any comments you might have. We'd also like to note that we expect people in attendance may hold different perspectives on the significance of Dobbs v. Jackson's Women's Health Clinic. We ask that this be a respectful and civil discussion. We may not agree with some of the ideas expressed, but you're responsible to listen and respond respectfully. And before I begin, I want to thank Diana Lazoff, Andrea Hunley, and Jonathan Alacor for assisting with the organization of the event. So let me turn this over to you, Sonia.
Thank you, Nancy, and welcome all for taking time out of your schedule and spending it with us between now and the next hour and a half. We have a distinguished panel, as Nancy pointed out in her introduction, so I won't repeat that other than to say how important it is to have this level of expertise as part of our discussion today. And I just want to make sure the only other rules is, again, building on Nancy's last point, we're going to be as respectful as possible, recognizing that there are a lot of important issues in play here. This morning, as I was preparing for this event, I happened to watch the hearing before the House Judiciary Committee about post Roe versus Wade. And I can tell you, I recommend that you take a look at it. It was on C-SPAN for 4 hours. And a lot of passion and dispute was on display in terms of how should we understand the impact of the Dobbs versus Jackson decision. So that's another reason it was in our heads that this is still very much an issue in play. It's the first time in our history that a fundamental right has been retracted. It's not because we haven't had other major cases overturned in a subsequent time, but it's the first time that a right recognized by the court was subsequently now not recognized. And that adds to the urgency of this moment to now understand what is an appropriate response. Is it just to accept the fact that we're going to have red states and blue states with different laws and attitudes towards the issue of reproductive health and equity? Does it mean that nothing else can be done? Those are some of the issues we'll talk about towards the end of the program. But in starting our discussion, it's a reminder that our union is not perfect. We said from the beginning, we're trying to make a more perfect union. And we're at one of those inflection points where there is a great deal of concern and controversy over rights and who gets to enjoy them and who does not. And now we're talking about the status of women in American society in a way that we have not addressed directly in nearly 50 years. And that is part of our discussion today. I just wanted to make sure I gave you a sense of how we're starting without taking time away from our guests. And we're going to start with Laura. And I'll, as you know, we'll go roughly 7 minutes or so. And feel free to start.
Thank you. And thank you for creating the opportunity for this dialogue and forum today. So I want us all to start by recognizing that the Dobbs decision doesn't just impact women. We can center their experiences while recognizing the impact on trans and non-binary folks with the capacity for pregnancy. And also, it's worth acknowledging that the loss of Roe will impact the men involved in pregnancies as it shapes their families and their reproductive lives. It will also affect children, both those resulting from forced birth and the children that those seeking an abortion already have. And to be clear, given the current news cycle with what's going on in Ohio and Indiana, it will impact girls who need abortion long before they're old enough to be called women. So because of Dobbs, I think 4 things will happen. First, people will have their reproductive autonomy compromised or overridden by the state. And part of this is going to be an expansion of the policing of women's bodies, in which pregnant people, or even those who could become pregnant, are subject to oversights, limits, and intrusion in their lives. And with this loss of autonomy, people who want abortion will have to do one of 3 things. Some people who need an abortion will try to travel across state lines to obtain an abortion. Some will seek to self-manage their abortion with means outside of the healthcare system. And there'll be some people who won't be able to access abortion and will be forced to carry their pregnancy. As a demographer, I find it frustrating that we don't have a sense yet of the size of each of these groups. Things like abortion funds and practical support networks, clinics shifting their location or new clinics coming up, particularly at the border of states which allow and don't allow abortion. All of this will change the opportunity and access to abortion in ways that means that older research, particularly pre-Roe research, but even not just from a few years ago, means that this older research likely doesn't provide a clear projection for what the future will be. Around these abortion funds and practical support networks, we don't know if these groups and resources are going to be able to scale up as they're called upon to do more, or what new restrictions they may face as states say they're going to try to prosecute anyone who helps people have an abortion. And the commitment and energy of advocates in these spaces right now is staggering, but will it be able to hold up over time? I don't think any of this is getting resolved very quickly. But even if we don't know how many people will face these different outcomes with abortion bans, we do know that across the board, the Dobbs decision would broadly impact Black and Brown patients and those living on low incomes. It's already difficult for many in these communities to pay the financial and logistical support of abortion care. So at their core, these abortion bans are racist, and they will make access to reproductive health care for people of color and those working to make ends meet even more difficult than before. So even before the Dobbs decision, there were people who needed abortion who traveled across state lines. Sometimes it was just because the provider in a different state was the closest. And sometimes it was because of limits and rules in their own state that they were trying to get to a more liberal setting. But as we expect 26 states to ban or place significant barriers on abortion, it's clear the need to travel out of state will increase. And this travel is a challenge and it's a barrier. It increased costs, whether for travel, for hotel, for childcare, for time lost from work. And all of this also serves to increase the time until someone can get an abortion. And when abortions happen at later gestation, the price rises, which increases the cost. And we get into a recursive cycle here. But these delays are important. And the recent abortion bans in Texas offer a glimpse of what we might expect. So SB 8 banned abortion after 6 weeks in Texas, and it went into effect in September 2021. At this point, the number of Texans traveling out of state increased tenfold. Almost half of that care was received in Oklahoma, but that state has just instituted its own abortion bans. And as bans increase, different distance required to travel to an open clinic increases. We also have a domino effect as people traveling to safe haven states increase patient volume, increase waiting time, and then even people in the state will face delays in getting an abortion. Now, for many, the cost and time needed for travel will be too much to navigate. And some people will use safe and effective medications to self-manage their abortion, and some will use unsafe methods to end their abortions. And we will see both pathways, and both are going to be exposing people to legal risk. Recent data suggests that approximately 7% of individuals in the US attempted self-managed abortion at some point in their lifetime. And we know that in the face of increased barriers, people use ineffective and unsafe methods to end their pregnancies. So this number is likely to grow. But I want to emphasize that just because something is illegal doesn't mean it's unsafe. What is risky is the criminalization of people who have abortions. Medication abortion has been shown to be highly safe and effective. And its availability means that the image of coat hangers and back alleys from pre-Roe is no longer appropriate, and it may serve to scare and stigmatize when safe options are available. But we need to lift up trustworthy sources of information, educate people about their safe options, and be concerned and develop systems for monitoring incorrect myths and misinformation on the internet and other social media. Young people are going to be learning about medication abortion from TikToks, and how do we keep that medically accurate? And this is so familiar to the work that I've done around the promotion of abstinence instruction. And when young people had to turn to the internet, turn to Google, turn to one another in social media to learn about contraception because it wasn't taught to them in school. So someone can't travel to another state and doesn't self-manage their abortion. The next outcome is being forced to carry a pregnancy to term. For some, this will increase the risks of morbidity and mortality. and it will also have profound negative consequences of their health, their economic and psychological well-being for them and their children. It's not just that Dobbs takes away an essential part of reproductive health care and reproductive autonomy, but it also leads to worse health and social outcomes for people and their families. So I very quickly just want to end by talking about teens. I suspect Ted will do this a little more, but young people, especially those under age 18, will be disproportionately affected by abortion bans. About 50,000 adolescents need abortion each year in the US, and laws that apply to everyone regardless of age often differentially impact teens, for whom waiting periods, mandatory testing, and gestational age limits may be insurmountable. And importantly, minors lack access to confidential care in 38 states, as parental notification or consent is required before obtaining an abortion. And that 38 state count is separate from the bans. So of those states where parental consent or notification are not required, the only states not on the East or West Coast, the only states are Illinois, New Mexico, and Alaska. So if you're a teen who lives in the center of this country or in the South, you have a long way to travel to get to a state where your parents don't need to be notified or give consent. And we should expect new laws that seek to charge anyone helping a minor to cross state lines for an abortion. Indiana is ripe for this type of limit, as they aren't very happy that Illinois is so close. So I'm just going to end with my first policy recommendation, which is to support haven states, those that don't have a bans on abortion, and push those, these haven states, to get rid of their minor consent laws. Just this week, Minnesota reduced its parental consent requirements. North Carolina and Colorado or other states where lifting parental consent requirements could make a real difference. Thank you.
Thank you, Laura. And you mentioned Ohio. It's been in the news. You also mentioned Indiana. I think there was discussion concerning a 10-year-old girl who was impregnated after being raped. And there was a lot of controversy over that. And then the person accused of being the rapist was arrested. And now apparently and she was allowed to go to Indiana for an abortion. And now the Indiana Attorney General is threatening to investigate the doctor. Did you hear anything about that?
Yeah, and I mean, there's a lot we can say about that, which was the political manipulation of saying this story can't possibly be true. Why couldn't it possibly be true? We have counts of the number of people under 15 and under 14 who have abortions in every state. It's a real count. It's in our data. So why did we think this wouldn't be true? Because people didn't want it to be. And in Indiana, providing an abortion is legal. So the idea that the Attorney General is going to go after a physician who's doing something illegal raises up all of the risks that physicians are going to face. I'm working with a group of physicians and others in this youth reproductive equity organization where we're trying to bring researchers and clinicians and advocates together. And the providers are very concerned that all of their medical malpractice does not cover committing a felony. So it's nice to say, oh, well, they should just stand up and do what's right, but they're putting their careers on the line. And these providers don't want to leave their states. They care about their people in their red state. It is their community. It is their patients that they care about. And picking up and leaving is not their first choice. But if they can't practice medicine, it's going to be a problem.
Thank you, Laura. And now we'll turn to Ted Joyce. Ted, the floor is yours.
Thank you, Sonia. And thanks, Laura. I'll maybe fill in a little bit of some of the stuff you mentioned. I'm going to share my screen and go right here. Let me do the slideshow here. So I just wanted to tell you, this may be redundant to this audience, which is clearly a sophisticated audience, but let's just talk a little bit about the demographics of abortion in the United States. So poverty and fertility control really is, abortion is a form of fertility control for poor women. Let's just put it directly, okay? So right now, according to gut marker surveys of abortion patients, about 50% of all women are poor, which means they're below 100% of the poverty level. 75% of abortions are to women who are below 200% of the poverty level. 49% of poor families lack at least $400 in available cash based on the Federal Reserve. It's been changing. So this is the data also from the same survey in 1994 in which they collected poverty data. So you can see 25% of all abortions were to patients who were less than 100% of federal poverty level. That is now doubled to 49% in 20 years. 49% were less than 200% of poverty. It's now 75% or less than abortion patients are less than 200% of poverty. So clearly this is 2014. It's probably worsened in the last 8 years. You can see the point is that abortion is really going to affect a certain group more intensely. What are the barriers? Laura already mentioned that they're pretty straightforward. The first one is clearly finance. If you don't have cash on hand, a first trimester abortion is going to cost you about $550. Once you start getting into second and later trimester abortions, it rises to $1,500 to $3,000. And essentially for any red state, it's going to be cash. It's going to be cash, and raising that kind of cash causes the delay that Laura is referring to. The other thing is you take young women and women who don't recognize their pregnancy. This is what a pregnancy looks like at 14 weeks. Barely noticeable, right? Barely, unless the woman's on top of it, she may not even know she's pregnant. So immediately before she even recognizes she's pregnant, she's into the 14th week. She's looking at thousands of dollars in cash for this termination. And she's looking at providers who basically can only provide terminations. I think 25% of abortion providers do terminations that are beyond the second trimester. So even the pool of available clinics kind of shrinks rather quickly on you. The third issue is ambivalence, right? 85% of all women who terminate are unmarried, but in relationships. And the ambivalence of whether they should go through with this, whether they should work this out with their partner, all of this delays, and this delays, as Laura noted, snowballs quickly. So the margin, I think, of people that are going to be most affected are those after the kind of medication gestation limit of 10 weeks. Women who find themselves in 11, 12, 13 weeks starting to look for a termination and have to take now very drastic measures to kind of satisfy that. So it's not looking good. The other question I think that Sonia had raised for us was how has abortion services changed in the United States? Well, remarkably, they have gotten more conservative. Clearly, states have kind of clamped down since 2017, and yet abortion rates have actually risen between 2007 and 2019 in GOT market data. And if you go to 2020, because 20 includes COVID, which is kind of a weird year, you still see a rise in abortions. And that is despite the fact that states like Texas, and like Mississippi, like Kansas, have imposed more and more restrictions on women trying to seek abortion. So women seem to find a way to do it. My point also is that the clinic structure, as limited as it is in the Midwest and the South, has been able to basically service and increase the number of abortions served to women. So I think that's an important point to make. I also want to make the point that we did a study in which we got data from New York State from 1971 to 1975 of all the induced terminations performed in New York State during that 4-year span. They coded the state of residence. What we did is we took the women from each who terminated in New York and put them back in their state of residence and computed the abortion rate by state of residence for all abortions obtained in New York State. The point here was to show you the incredible amount of travel that was done prior to Roe coming to New York to terminate. Just to look at the numbers on the left here. In Connecticut, for example, there were 7,500 abortions per year performed in New York State. Currently, under a perfectly legal environment in Connecticut, there's 9,000 abortions performed in the state, all right? In Michigan, 13,000 women per year left the state to go and terminate in New York. Today, 27,000 women in Michigan terminate. Ohio is amazingly dramatic. 15,000 women per year, that's per year in 71, 72, traveled to New York to terminate their pregnancy. Today, Ohio has 20,000 abortions per year under a legal but restrictive environment, okay? So the point is that women will travel, and they will travel, and I want to be a little bit more optimistic because the wild card here is really going to be medication abortions, which Laura has referred to. And this is data, we had individual level data from the state of Arkansas, and we were able to basically look at this line here, which is the percent of abortions in the state by month that were performed via medication, all right? So you can see among white non-Hispanics in Arkansas, it gets to about 60, 70%, it falls, but here it is. This is April of 2020. Now, why is that interesting? It's because Arkansas basically outlawed surgical terminations in the first month of COVID. It was a common strategy among the red states to basically go after abortion services during COVID. It lasted only a month, but the important point here is that women reacted immediately. They converted. There was only one clinic in the state that did surgical abortions. After this injunction or this deceased order goes into effect for the clinic, women are allowed to have medication abortions, and medication abortions jump to 87% of all terminations in the state. More importantly, if you look at Black, non-Latino women here in Arkansas who had a lower use of medication abortions, they also jumped up usually to 80% medication abortions. My point being, women found a way. And Arkansas is really a tough state, right? It has a mandatory waiting period, which requires a 2-visit in-person requirement. In other words, you got to go, you got to get this crazy speech, you got to go home, you got to wait 48 hours, and then to come back and get your medication pills. And then for medication abortions, you're required by law to return for a 3rd visit 2 weeks post-medication in order to confirm the abortion, right? So it's extremely onerous, and yet women figured it out and did it. So I think we should have some optimism about the agency, both among states that aren't going to ban it and among women in states that are going to ban it. They're going to find ways to get help and to get determinations. So I just want to make the other point here is that, when you do medication abortions, you have to be careful. Because it's a percent, right? It's the ratio of medication abortions over total abortions. Now, medication abortions may not change. If total abortions are falling, this percentage will simply rise. But in fact, in Arkansas, during COVID, the number of abortions rose in the state, and they rose more among Black, non-Hispanic women than they rose among whites. So again, the most disadvantaged potentially found ways to basically exert their weak reproductive rights. All right, that's my kind of optimistic closing. I'll stop there, and thank you.
Thank you, Ted. I guess it leaves that question of if people are still going to be pursuing abortions going forward, what's the appropriate policy response in terms of how the states that are receiving these new entrants for this reproductive care, what should they be expecting? And I think you're giving a sense of that from your data.
Well, I think Laura also mentioned it, that you basically, the legal issues I don't know yet. In other words, can you prosecute someone from Arkansas who goes to Illinois, who terminates and then comes back? I don't know that, right? Kavanaugh, in his statement, in his opinion, basically said it's not going to stop women from going across state lines. He thought that was going to be protected. That is not clear. So that has to be worked out. The other thing is some states like California, New York, and Connecticut have said their prosecutors will not cooperate with prosecutors from other states. Very good news. California's created a fund for women from out of state who's going to go and terminate in California to help support them. So hopefully there's a lot more of that, both private donations and state support for women coming to their state from out of state who can't afford, which is going to be an expensive situation given the delays. You can see what happens when you get into 2nd trimester terminations, how late it is. A termination at 18 weeks takes 2 or 3 days. And so you have to stay in a hotel for 2 or 3 days while this goes on. So there are a lot of issues to work out and a lot of costs involved. And hopefully, I think as Laura said, states respond and we all respond in a kind of constructive way.
Thank you, Ted. Dana, I'm coming to you now, and I'll save my legal questions for after you're done, but take it away.
Hi, everyone. Thanks so much for having me. I'm Dana Sussman, she, her, acting executive director at National Advocates for Pregnant Women. And I want to uplift something that Laura started off with. While our name is National Advocates for Pregnant Women, we also recognize that not all people who get pregnant and seek abortions are women. And in fact, the reinforcement of the gender binary has been oppressive to everyone. With that said, I am here to talk a little bit about the criminalization of pregnancy and abortion. And what NAPW does and has been doing for over 20 years is defending the rights of pregnant folks who face criminal charges or other state intervention that limits their liberty in either the civil, the child welfare, or the criminal context because of pregnancy. So in other words, they would not face this state intervention if they weren't pregnant. It's an essential component of the crime they're being accused of or the actions they're being accused of. You might be surprised to hear that people have been criminalized because of their pregnancy or pregnancy outcomes, but we have been tracking this information since 1973. We published a peer-reviewed study in 2013 that looked at all of the cases we could find from 1973 to 2005 and identified 413 cases. And the ways in which people are criminalized because of pregnancy in a world in which Roe was the law of the land when abortion remained a fundamental right, involve the application of laws that were never intended to apply in the context of pregnancy. We're talking about child abuse laws, felony child neglect, murder, manslaughter, feticide in the context of a pregnancy loss. And what is at the root of all of these prosecutions is the same ideology that underpins restrictions on abortion access, and that's the concept of fetal personhood. Several highest courts of states in the country, 3 currently, have determined that their criminal laws apply to fetuses. In one state, it's, quote, viable fetuses. In another state, there's no limitation on viability. And we have been operating in those states and in several others in a world in which it's almost as if Roe doesn't exist. And for many of our clients, that's certainly been the case. We are currently analyzing data from 2006 to 2020, a new data set. And what we have right now is 1,331 cases. So more than 3 times as many cases in less than half the time of criminalization because of pregnancy. And again, these are cases involving child abuse charges, child neglect charges, chemical endangerment of a child, delivering drugs to a minor under the theory that a pregnant person delivered drugs to their fetus via the umbilical cord. There's no shortage of creativity, unfortunately, in the ways in which criminal laws have been used to arrest and prosecute and jail, imprison pregnant folks. We anticipate a rise in, not surprisingly, a rise in criminalization in a post-Roe America. There is a lot of focus right now on the states that have banned abortion and the fact that those state laws, that the bans, the trigger laws, do not explicitly criminalize the pregnant person. The focus is on prohibiting or criminalizing the provider from providing abortions. But what we know is that the fact that a law doesn't explicitly allow or articulate that a pregnant person can be criminalized does not stop prosecutors from doing so. And our collective numbers of over 1,700 cases since 1973 demonstrate that very clearly. So a couple things that we are watching. I think there's 3 buckets that I'll talk about. One is fetal personhood laws. Fetal personhood laws exist in 9 states currently, at least 9 states. And these are broadly definitional laws. They redefine a person or human under their criminal laws to include a fertilized egg, embryo, or fetus, or a being from the moment of conception, or, it sort of varies, but the gist is the same. All of these laws were passed with Roe on the books. I have a somewhat cynical view that even the folks who passed these laws didn't fully contemplate or understand what that means to redefine a human or a person under your entire criminal code, and in some cases civil codes, to include a fertilized egg, embryo, or fetus. So because they were passed with Roe and Casey on the books, my sense is that some were passed in a more symbolic gesture of, this is sort of who we are as a state. This is a value that we are upholding. And now that we don't have the protections of Roe and Casey, I anticipate we will start to see prosecutors attempt to utilize these new definitions of human and person to prosecute pregnant folks for all sorts of birth outcomes. It could be healthy birth, it could be pregnancy loss, or it could be abortion. Another category of laws that we are closely looking at is feticide laws. 38 states have feticide laws, which were always passed under the often, I think I can say always, I'm fairly certain, passed with the pretext that they were intended to protect pregnant people from violence. What typically sort of the most typical fact pattern is a pregnant person is horrifically attacked by someone else. They may die, they lose there's a pregnancy loss, and a prosecutor under a feticide law can charge, essentially there's two victims of the crime. It's both the pregnant person and the fetus can be crime victims, and there can be a charge associated with the pregnant person and a separate charge associated with the loss of the pregnancy. Those laws have been used in several cases to prosecute the pregnant people themselves, even if there's explicit language in that law, or there's explicit very clear legislative history and legislative intent not to apply to the pregnant person. Pregnant people have been blamed for their causing their pregnancy loss and then charged with feticide. In some of those statutes, we have to look very closely at the language of the statute, because there might be an exemption written in that says, this doesn't apply to someone who procures a legal abortion. Well, if abortion is no longer legal in your state, that exemption will no longer apply. So we're looking very closely at feticide laws. And again, they have been used already to prosecute pregnant people with Roe, and we are concerned that we will see more of those cases. And you might have heard about Lizelle Herrera out of South Texas. That was a case we understand was brought under the Prenatal Protection Act, which is Texas's feticide law, that had very clear language that this was not to be applied to the pregnant person. Despite that, the prosecutor got an indictment. I mean, they were far along in the process, and if it wasn't for the activism of the local advocates on the ground and the national spotlight that they were able to bring to that case, I imagine she might have been in a situation where she would essentially be forced to plead to something and get a lighter sentence. But so we see prosecutors use laws in ways that are improper, that expand the definition of who the victim is intended to be, of who the perpetrator is intended to be. And it is our job at NAPW and with our advocates and allies to hold prosecutors accountable. And then the third category that we are looking at are these abortion bans that may have vague enough language to allow, I don't even say allow, but to make it plausible or to pique a prosecutor's interest to use those laws against pregnant folks themselves. And that is in the context of someone who obtains medication in a banned state, or someone who leaves their state to seek an abortion elsewhere and then returns. Again, there's nothing explicit in laws on the books right now that targets the pregnant person, but our cases and our years of experience lead us to believe that prosecutors will attempt this anyway. And so I do want to, I painted a pretty bleak picture. I want to leave with some moments of hope or some progress that we've made in certain places. And I'll share just one case example. And that is the case of Adora Perez. She is a woman who experienced a stillbirth. She was charged with feticide in California, which is part of the homicide statute. She ended up pleading to manslaughter of a fetus, which is not a crime in California for the pregnant person or a person who's not pregnant and who harms a pregnant person. It's just not a crime in California, period. She pled to that, poorly advised by her court-appointed attorney. She was serving an 11-year sentence. And after 4 years in prison, her plea was deemed unconstitutional. She was released, and then the prosecutor dismissed the underlying murder charge in May of this year. Her case and another identical case out of the same county, same hospital, same prosecutor, Chelsea Becker, who we represented and who worked with us over 19 months while she was incarcerated in jail. Her charges were also dismissed. And the DA who brought those cases lost his primary a couple weeks ago to a more moderate Republican challenger. It is in California, but it's in an incredibly red state in the red county in the Central Valley. His challenger made this a campaign issue. She actually attended rallies in support of Chelsea and Adora. She took the position that those prosecutions were wrong. And even in a really conservative place, she won. And because the statewide politics are what they are, we were able to use those cases to galvanize the Attorney General, the governor, the legislature. And there's a bill that is likely to pass very soon that will make it even more clear that these cases are not permissible under California state law. So, progress is possible. These cases do generate a lot of outrage, and it's part of our work to use them, ensure that the person is getting excellent representation, and also generate public awareness and education and outrage and hold prosecutors accountable. And then maybe they won't be reelected in the best circumstance. So that is sort of, I'll just reiterate that this, as I said before, the same forces that are at the root of criminalizing pregnancy and pregnancy outcomes, the ideology surrounding fetal personhood that is used to control people with the capacity for pregnancy, women, are the same that are used to justify these abortion restrictions, which is also about control of people with the capacity for pregnancy. And they will disproportionately impact people of color, low-income people, drug-using people. These cases have been for a long time the sort of canary in the coal mine for ways in which our country removes the bodily autonomy of people when they are pregnant. And we are concerned and are gearing up for more of these kinds of cases. So I'll pause there.
Okay, well, we have a lot on the table from our three guests. I just wanted to make one comment in response to Dana's presentation. A case in Virginia, a pregnant woman decided to use the HOV lane because under the theory, hey, there are two of us, and she got a fine for $256, and she was challenging it, saying, hey, you're saying personhood and all that, so why aren't you giving me my HOV pass? So we're going to see a lot of crazy stuff going on. But the other reason I was raising it is to talk about what does the right to travel mean in the context of what we're going to see next. I'm sure our guests could all speak on this at length, but I just wanted to put a pin in that to say there is a constitutional right to travel, and now we're going to see it conflict with some of these state laws. And so do we have any questions in the chat? I didn't have a chance to look before. We'll get to those after we finish our formal part, but I just wanted to make sure that our guests know that we will be happy to answer your questions. We've left 30 minutes for that. And in the meantime, I just wanted to, as I said, make the point that the US Constitution, at least as of right now, recognizes and protects the right to interstate travel. And now we're going to see how that fares in this ongoing debate over what happens next. Okay.
Point out that that's not always the case for minors.
That's exactly right. It's not the case for minors, it's for adults, right?
And even when it might be, states are doing things like you can't buy a Greyhound bus ticket if you're a minor, to limit who can leave the state.
Yes. But that's the reason I wanted your reaction, because we're going to see all kinds of efforts to make it impossible to leave the state. And especially if you're poor and can't fly, or you're going to have to drive through 3 states. I mean, what else is going to happen as the direct result of this case going forward? Ted, any thoughts on that?
In terms of travel, or is that what you're asking?
Start there, but
Okay.
any other impacts that you see?
Oh, I think the first order effect is clearly going to be on fertility. That's, let me share this, move to what I wanted to show. So,
Take your time. We're ahead of schedule.
Sorry.
That's all right.
Yeah, all right. So this is data that we have from the pre-Roe period, and I wanted to link it to the travel issue because a lot of people think that it was Roe that was the most important thing for basically the outcome here is fertility, it's birth. That's going to be the first order issue here. We're not going to be able to measure abortions very well. There'll be a lot of illegal abortion. There'll be medication abortion that'll be hard to trace, et cetera, et cetera. So the abortion numbers are going to be really kind of vague, I think, in this post-Roe world. And what's going to be the most hardcore number is births. In other words, if women are restricted in states that ban abortion, do you see a rise in unintended childbearing? Do you see a rise in births? And how much of the rise do you expect? So Caitlin Myers from Middlebury has been doing a lot of work on this. She's mapped the entire state, United States. She has distance to every legal provider under various scenarios. And her best estimate that abortions will fall about, there'll be 100,000 less abortions in the year after Roe is overturned. That is taking into account that there are about 26 states that will ban it. And if you take that number hard, then that's about, a 2% increase in births, which is not huge relative to, I think, what people are expecting. And so I go back to 1970, and here I have showing a line that shows you the birth rates in 4 different kinds of states. The blue one is states that repealed abortion completely: New York, California, Washington, D.C., Alaska, Washington State, and Hawaii. The green line are states that were close to New York. So I showed you earlier the travel that went on to New York. The third line are states that had repealed their laws, like North Carolina actually had a reform law, not a repeal, a reform law that women could get terminations under certain circumstances. And this last line here, this broken line here, are the other states that were the most restrictive. But what you notice is that birth rates fall significantly between 70 and 73 prior to Roe. And all this represents travel to California, Washington, New York. And that was the big decline. And then you see after, when Roe is legalized, there's not much impact on fertility rates, which is kind of surprising, right? So yeah. The point I kind of took away from this is that there's a lot of travel that went on. As Laura brought up, travel and the women who terminated in 1970 to 72 are a very different population than the women who are going to be exposed to an unintended pregnancy today. Nevertheless, as Texas has shown, women will travel and will travel distances to terminate, or they'll use other methods. So births are going to be the number we're going to have to focus on to get the impact, the first order impact of the bans is going to be on unintended childbearing. And I just want to bring this information back from 1970, which I think is instructive because it's going to happen. The travel is going to help people avoid an unintended birth. So I'll stop there, Sonia, and let
Dana. Thank you, Ted. Any thoughts?
Well, I actually had a question for Ted or anyone else, which is, sure. I'm curious. So if I understand the timing, SB 8 in Texas, the first civil bounty law that essentially eliminated abortion in the state after 6 weeks, has been in effect for over 10 months, 11 months, a year now, maybe. Is there any data coming out about the impact, the changes in birth rates in Texas for people who have been living under this regime for a longer period of time?
I haven't seen any. It's still a little early in my mind, given that you're talking you need another at least 6 months in order to start to pick up a woman who's trying to terminate at 12 weeks and then ends up carrying to term. The numbers are not going to be huge. You're going to have a statistical power issue to kind of tease it out. Texas has hundreds of thousands of births, so noticing that little blip in births is going to be hard. So Right now, it's way too early to call.
And just to add 2 points to that, one is that the Texas Department of Health, for a variety of reasons, is not happy about sharing its data. So I think they're going to slow down processing and producing that. I wouldn't hold my breath for the timing. And the second is that TextPep, a research group based out of the University of Texas, their somewhat back of the envelope estimate is that 90% of women who were seeking abortions were able to get them. So in one form or another, that includes ordering medication abortion through the mail. Again, it's a very back of the envelope calculation, but like Ted's saying, if 10% of abortions now became births, and maybe it's 9% because of pregnancy loss or something like that, that's just not going to be a big blip in the birth rate.
Thank you for that, Laura. I guess the next question I'd have for the panel, and we have about 5-6 more minutes before we go to the questions from our audience. I guess I would be interested in your thoughts on what happens next with respect to privacy rights more broadly. So for example, if the right to privacy, as I understand the opinion, and I did read all 213 pages, there is now a real question mark that would apply to any other cases that relied on Griswold versus Connecticut as the constitutional foundation for the right that was recognized in the particular case. And so I guess my concern is, what else should we be expecting if this is, Justice Alito's attempt to say, oh, this only applies to Roe v. Wade and Casey, as opposed to other areas involved with respect to the right privacy. Who wants to go first?
I can kick us off by saying that I think all privacy rights are potentially at stake. I thought that Justice Alito's distinction between the abortion right and any other rights rooted in the privacy right is essentially that this is a complex moral issue, and so this is different than everything else. Well, it could be anything could be. I mean, this is such a results-oriented court at this point that they will create and undermine precedent in wait just to get to the outcome they want. And so I'm very pessimistic about this distinction that Justice Alito is attempting to make, to say, access to contraception, same-sex marriage, this is different. And I'm not really even able to articulate why, but it's different and we're not going to go there. We all know that Justice Thomas said we should absolutely be revisiting all of these things. And so if they have enough votes on the court to do it, they will do it. It's really at this point, the whims of the majority, in my view.
Thank you, Dana.
Yeah, I'm just going to go. I mean, I'm not an attorney, I'm a demographer, so let's just be clear. So I want to just talk specifically about access to contraception. So it took about 12 hours for states to step forward after this decision to say we want to outlaw certain forms of contraception, particularly at risk are IUDs, implants, and emergency contraception, because of an incorrect belief that those act as an abortifacient after conception, as opposed to the mechanisms that they actually do use. So some of what has to happen is, for example, the FDA wording around emergency contraception leaves the door too wide open around what the mechanism of action is. And the physician groups are very clear about guidance on how that should be changed. So this president and this FDA have actions that they could take that would help. I'm not saying it's going to solve. If they want to put contraception on, there are places that will happen. But we need to be doing a better job of being clear on how these methods work.
Well, and the fact that you raise it in that context of a potential executive order or a political approach puts back into even more clear focus the importance of the midterm elections. Who's going to be in charge of the House of Representatives? what will be the numbers in the Senate between those who want to see some action to restore the Roe opinion and those who are opposed. I mean, that's the political ramifications of where we are right now. But it also is a function of what will the people do, those who are happy with the decision in Dobbs versus those who are not happy. And the only reason I pose it that way is that up until the decision, there was still a majority of Americans who favored access to abortion. So I'm, again, looking at it from that lens of, from not just a policy standpoint, which the FDA, for example, could do something, but also the political ramifications. I'm sorry, Ted, I didn't go to you. I wanted to make
It's
sure.
okay. I have nothing to add. I have no expertise in the area, so that's fine.
Okay. And so as part of our desire to make sure we are being fair to our presenters and our audience, I want to give each of our speakers a minute or so just to give your final thoughts before we open things up for the questions, which, thank you, audience. We now have a lot to get through. But in the meantime, I wanted to at least let each of you have a chance to say something. I'll start with you, Ted, go with you, Dana, and end with you, Laura.
I think I've said most of what I want to say. I'd rather save time for questions that will be more directed, so I'll stop there. Thanks.
Okay, no, thank you. Dana?
I will just offer a few quick takeaways. One is action at the state level is critically important. And if everyone here is in New York or, close to New York, we can adopt a state, and support and get educated about local elections in places like Pennsylvania, North Carolina, Michigan, and support the work that's happening on the ground in those states to protect access to abortion. North Carolina is just an example. They have a Democratic governor and a Republican legislature. If the Democrats lose any more seats in the legislature, the Republicans can override the governor's veto. Right now, he's the only thing protecting the right to abortion in the state. So, I think holding the line at the state level is incredibly, incredibly important. Every day that we have clinics that remain open, whether it's in Louisiana that has gone back and forth, I think like 4 or 5 times since the decision, is a victory. That's how we have to look at things now. And then, people should support local grassroots organizations in those states, particularly led by people of color who have been doing this work in their communities for a very long time, and the abortion funds in those places that are getting people the resources that they need to get out of their states to get care. It's a matter of resources. The money that goes in is the money that goes out for abortion care. And as Ted said, even in the best of times in America, abortion was incredibly expensive, and it's going to be far more expensive and delayed, which creates more expenses on top of those for people. So if you've got resources, that is desperately needed.
Thank you for that. Laura?
I'm going to end with some personal advice to the Cuny community, my perspective on this. So one is, as we all go off and we want to research this and how the laws matter and how it varies state to state, and we're running our difference in difference models and whatever it is that's going on, please remember that your natural experiment is someone else's loss of autonomy. And please treat their experiences and with the dignity that they deserve. This is not, when I see people say, oh, this is going to be exciting at the work we get to do, it is not exciting for the people who are impacted by this. And then the second, and I don't know, maybe someone here knows the answer, is Cuny has a huge number of students and a huge number of staff. What are they doing to make access to abortion accessible through the university and get those people out of the rest of the healthcare system in New York City so that the system isn't slammed as more people are coming into the state? Cuny can play an active role to make this domino effect better.
Well, on that note, we'll take the Cuny charge, Laura, to our faculty and beyond. But I'd like to just stop right here and acknowledge our 3 guests and our our gratitude for you taking the time today to spend this time with us. And now we'll spend the next 30 minutes talking through the questions that have appeared in the chat. And I'll start with the one from my colleague Neil Bennett, who asked, what kind of efforts exist to publicize the existence of funding to help pregnant women travel to another state to have their abortion? I would imagine that many poor women may not be terribly internet active and may not be aware of such programs. So how do you get the word out?
So in materials that will be sent out after this talk, I've included some links to mechanisms to find an abortion, and particularly as people who reside in New York, people are going to ask you. So I suggest knowing how to get an abortion in New York so you can be, an expert and evaluate sorts of information on that. But more broadly, what's happening now is if you can't search on the internet, and many improved sites are being built on the internet with strongly vetted information. But if you can't get to the internet, the best mechanism that's working right now is people are calling clinics in their home state, and those clinics are giving them information. But that is going to fall apart quickly. Those clinics are going to be gone, and giving information may become illegal. The clinic at the center of Dobbs in Mississippi, which was already the last abortion clinic in Mississippi, has closed its doors and is moving to New Mexico. That's quite a long trip from Mississippi to New Mexico. So there really are going to be, I think, deserts of information as well. And I really do take to heart the idea that I spend so much time on Twitter, but not everyone does, and particularly those most vulnerable here really don't have those sources of information. It's going to need to come from doctors, and this is a problem. There's a legacy of the abortion providers being incredibly someone help me, what's the word I'm looking for? Constrained. They're in clinics, they're outside of the regular health system. Your OBGYN doesn't give information, doesn't provide an abortion, and
right,
kind of setting may or may not provide information. So all the major medical groups are stepping up with very strong statements on the need for their providers to be sources of information.
But that reminds me of an issue too, Laura.
Siloed. The word I'm looking for is siloed. There we go.
There we go. But what your point made me think about is what's going to happen with medical schools in states that are going to totally abandon abortion as an opportunity. Will that impact the number of doctors nationwide that could even be available to provide that service in a different state? I mean, these are some of those long-term implications that start to be more apparent. It's already clear in a lot of medical schools that you don't have classes on how to conduct an abortion. And yet this seems to me to be something that's going to exacerbate that existing problem already. But I just want, go ahead.
It's supposed to be required, and my understanding from physicians is it's never been enforced. So schools, the state looks the other way, and the schools don't do it. And the people who want the training take a rotation in their residency out of state. I mean, that's already been the case in many places.
Exactly. No, I had a family member who had a similar issue. That's why I was sensitive to it, but it's not something we have been discussing. Dana or Ted, any other thoughts? I was going to move to a different issue.
Oh, go ahead.
Okay. Let's see. If we look at some of these other questions, I'm going to try and put as many together as possible. But one of the questions I'm coming to is from Perry Stein. Can the panel possibly touch on the broader implications of not honoring a personal right to privacy as laid out in the Dobbs decision? If you don't feel comfortable with that, I'll move on to another, but it's coming up a couple of different times in different ways. What do we do next? If the right to privacy has now been challenged, what is an appropriate response in terms of, first, the issue of abortion, but also concerns about what happens next? Any thoughts on that? I didn't want to presume because I could spend the rest of the time talking about just that, but I wanted to give you a chance first.
I'm not sure I have anything, incredibly creative to say. I do think that it is looking at state constitutions. It is looking at state laws. I hate to say vote, but we got to vote and do other things. I spoke on a panel yesterday where Senator Warren provided recorded remarks, and she reminded everyone that we're only 2 pro-abortion, anti-filibuster senators away from codifying Roe and more, right? Roe is the floor, not the ceiling. It is possible, as cynical as we all may be about how undemocratic the Senate is and how undemocratic our systems of government are, we can elect 2 pro-abortion, anti-filibuster Democrats. It's not enough to elect Democrats. We can't just sink into despair like that. That is what they want. And so we have to look at state government, state constitution, state laws, and also not give up all hope on the Senate, despite its problems and its limitations, because it is possible. And as we've discussed, Americans support the right to abortion. We have never had a fundamental right granted to us and then taken away like this. So maybe there is some possibility this fall. And another thing that I think is we should be pushing our elected officials to do, put up a vote on the right to contraception. Let's start trying these out and getting votes and having people have to force a vote on these issues. Just today, a bill introduced in the Senate surrounding the right to travel out of your state to obtain an abortion was stymied by Republicans. But we have to keep pushing these issues and keep holding hearings. Yeah. And if anyone hasn't seen, Professor Kiara Bridges testified at the Senate Judiciary Committee earlier this week. She's a board member of NAPW along with Nancy. Highly recommend that you watch that testimony. It was brilliant and a masterclass in how to talk about these issues in a truly intersectional way.
I appreciate that. And we'll make sure we list that testimony in the email we send out after the program. Laura, did you have a point on that?
Well, I just want to name what we haven't said yet, which is the right to marriage.
Oh, yeah. I was going to get to that, but go ahead. Take it away.
I want to make sure we're explicit about that. And
well, we have to be because of the concurring opinion. Let's not pretend that it did not happen.
Right.
Because it did.
It is not occurring in a vacuum, and the trans hysteria and the groomer language and the pedophilia language that's being used, and the battles against sex education, again, as being grooming, are all connected to this pushback against gay marriage. And I think it's coming very rapidly.
Yes, I would agree. I think it's a function of a number of different trends that were already in place well before this case was decided. But now that Dobbs is here, the question then becomes, as stated in Justice Thomas's concurrence, well, what about, gay marriage? What about, what else? Contraception? I mean, Griswold was all about access to birth control.
And sex itself.
Well, and sex itself, exactly, in the Lord's case. So we have a number of different precedents, and unfortunately, most of them were close cases in terms of 5-4, but they have not been challenged. And now I would argue we should be expecting that challenge. In today's hearing before the Congress, one of the more interesting points, it was late in the session, was one of the congressmen actually challenged Justice Clarence Thomas in asking why didn't he include interracial marriage in his list? And could it be because he's in an interracial marriage? That was put on the table during the hearing. And I'm like, okay, here we go. A lot of effort and attention to think about where else does this case go? That was what was going through my head as I was watching the hearing. But it's an indication that this is the beginning of some very, very tough cases that will be coming up in October and beyond. We're going to see challenges across the board, but also this issue of the right to privacy. Does it survive Dobbs? That's how I would put it. Any of our other panelists want to say something before I go on to another question? Okay, let's see. We've got a couple on. Josh asked, do I foresee any consequences for appointed Supreme Court nominees that have essentially lied under oath to Congress? No, I don't. I'll tell you that's not going to go anywhere. In part because we haven't taken that approach before. And if you go back, and I have looked at their actual statements, two of the justices on the court now basically said during their hearings, I'm not going to tell you. And the other ones made statements about settled law. Well, but now they've been persuaded that it isn't as settled. So what's the problem? That's where that is. So don't expect it. I'm just telling you. And it's one of the reasons there have been efforts to talk about expanding the court with 4 more justices. I don't think that's going to happen. I refer you to what happened when FDR, Franklin Roosevelt, tried that. He didn't get very far. He tried. He was going to raise the court from 9 to 18. And as you know, that didn't happen. But in the meantime, in withdrawing his efforts to go in that direction, he was able to get some key legislation like Social Security passed as a reaction for accepting that the court wasn't going to be expanded. So that's my short answer to that. Let's see, let's get to a couple more. We've got about 15 minutes left. Lee asks, how do we circumvent the Supreme Court rulings? Do we go to the streets, block access to the court? Hey, there's already a big fence around the court. They can't even get in through the front door anymore. They've got to go through the garage. But now the question will be, I think politically, how sustained will the protests be? And how do we keep them for those who care about these protests? Or even if you don't care about the issue, we don't want to see violence at protests. The question then becomes, how can the safety of protests be maintained as we go forward? Anybody want to take on how do we circumvent the ruling? I can't say because I'm a member of the bar, but if any of you want to say something, go right ahead. Thomas, Maine, you're mute. You're muted.
I'm not sure folks can unmute, so.
Oh, that's
All
right. Oh, just put it in the chat, Thomas. You have to put it in the chat because we had a, yeah, you got it. Okay.
In the meantime, there's a series of questions surrounding the concept of personhood and who is deemed persons under the Constitution. And I just want to uplift that and a couple other of those comments, because I think that's a really important point to remember. The right to abortion was grounded in the 14th Amendment and the privacy rights that emanated from the 14th Amendment and substantive due process. And the 14th Amendment articulated that it was for all persons born. Born. And so the court in Roe and affirmed in Casey that fetuses were not entitled to constitutional rights, but pregnant people were. And that is something that I think is sometimes forgotten to history, that fetal personhood was a concept that was rejected by the court.
That's correct.
And what Justice Alito has said, the most among, it's really hard to read. And I'm impressed, Sonia, that you read all 200 and something pages, because I definitely relied on colleagues to summarize parts of it. And there's what's particularly chilling for me in his decision is, he refers to it now as prenatal life. That's the phrase that he landed on. And that a government now without removing the fundamental right to abortion, because it's not a fundamental right, it's entitled to the lowest, any government restrictions on it only warrants the lowest level of scrutiny. And so if a government can say, we have a legitimate interest, a legitimate governmental interest in restricting this. That's enough to restrict the right. And he says that interest in prenatal life is legitimate to justify a complete abortion ban. So he is not saying, he sort of plays, he does the sort of, I'm neutral here on, I'm not gonna take a position on, when life begins. That's not what I'm here to talk about, but it's not, but some people believe that life begins at conception and some people don't. And a government can decide that an interest in prenatal life is sufficient to restrict the right to abortion. And that's basically all you need to show that it's a legitimate government interest. So I want to uplift that too. And then Dr. Bridges' testimony earlier this week before the Senate Judiciary Committee talks a lot about that the 14th Amendment was added to the Bill of Rights in 1868, where many people in this country were not considered people, or were considered or had the right to vote, or access to, or maybe had the right to vote but not access to the vote, or for the next half century didn't have the right to vote, and for many decades after that because of Jim Crow. So when we talk about the concept of people, who was the Constitution and the laws of this country designating as people at that time, and if we're going to hew to the interpretation of law of rights or amendments that were passed in the 18th and the 19th centuries, it's convenient that entire major parts of this country and the population of this country were not included.
Yeah, my ancestors for starters, but
yes,
we can look at how best to understand what will the 14th Amendment mean going forward. And I think that for legal scholars will be a very fertile ground to explore. Ms. Okey's question was, why was the 14th Amendment the one used to define person or personhood when discussing fetal personhood? Was this the amendment not directly addressing Black people in the US being regarded and treated as people? Yes, that was what the 14th Amendment was intended to do in overcoming the Dred Scott case that was the precursor to the Civil War in 1857, where the court 7-2 ruled that those who were whether enslaved or free, but from Africa, had no rights that this country must respect. And it was to overcome that language because it was an interpretation by the court of what the Constitution intended that required a constitutional amendment to undo. And so that's one of the ways to look at why is that section of the 14th Amendment expanded beyond those who were held in slavery to all persons subject to the jurisdiction of the United States were also entitled to those rights of equal protection under the law and due process under the law. So it's keeping that in mind as we go forward, that even if we have a debate and discussion of what should we discuss in terms of the rights of those who are not yet born in this context and in this space, because that's going to be part of these debates going forward. Let's see, I'm going back to, I think Thomas's question. Thomas Main tells us the Constitution allows Congress to limit the appellate jurisdiction of the court. The Congress could take the whole issue of abortion out of the hands of the court. Yes, that's true. Will it happen? I don't know. But those of you on the panel, if you have other thoughts about that, please feel free to share them. I don't think it's going to happen, but it only because our Congress and our Senate is so closely divided, I don't see it happening, but it doesn't mean it can't. Okay? Just as a reminder, we do have the separation of the three branches, and Congress could say, no, this is off limits until they choose to go in a different direction. Let's see. Okay. And now we have just about 5 minutes, a little over 5 minutes left. Let's see if I can get a couple more in. let's see. And Thomas, thank you. Article 3, Section 2, Paragraph 2, there's the power. So those of you students, start researching. And those who are taking my class in the fall, we're going to talk about this. So just be ready. Let's see. And let's see what else we can talk about here. Okay. Okay. All right. And again, I just want to give our guests one final opportunity to give some last thoughts before we do our wrap up. And I will start with Dana, since we ended with you last time. I'll let you have the first few words, and then I'll go to Ted and end with Laura.
Final thoughts. Well, I will also sort of uplift another comment around, I agree that this, and I think this is not an original thought by any stretch, that much of this, all of this is rooted in racism and white supremacy, which is inextricably linked to patriarchy and misogyny. We know that the movement to desegregate and integrate schools, the energy surrounding upholding segregated schools had shifted to eliminating the right to abortion. It was a way to uphold the sort of the Christian white demographics in this country. And I think that we really need to talk about it in that way. It was on full display in the language surrounding domestic supply of infants that, lots of people talked about. And I think that it is just incredibly important that we ensure that piece of this work is centered, and that we do what we can to support the organizations on the ground in really hostile places that are providing resources and care and information, and are doing it at great risk. I wanted to mention one thing that Laura had talked about around how people get information about how to access funds and other things. And there are a few clinics that have pivoted they were abortion providers. They're now providing comprehensive reproductive health care that's not abortion. So it's not fully comprehensive, but it's other forms of care, like the West Alabama clinic. They also need support. They're going to be a repository of information, contraception, screenings and care and education. And they're really doing what they can to stay within their community. So there are places to support that are doing that work. And then there are also new clinics that are opening. One is Partners in Abortion Care in Maryland. They are a new clinic that will be providing care throughout pregnancy, so not limiting to earlier abortions. And they'll be in Maryland, so they'll be positioning themselves to help people coming up from the South as well. So, there are places to support if you're interested.
Thank you for that, Dana. And the last posting to the chat was giving all of you the link to this session when it's ready, so that you will have it and be able to watch it on YouTube. Ted?
Yeah, I wanted to draw attention to Ezra Klein's podcast. I don't know if people have been listening to it, but he had a wonderful interview with Kate Greasley, who's a philosopher at Oxford. And I didn't quite appreciate the rigorous thinking of philosophers, but the whole debate comes down to, do you believe life begins at conception or not? And so she confronts people with this thought experiment. She says, you're running out of a burning hospital. There are 5 embryos that have been made via IVF, and there's a 6-month-old baby. You can only grab one in the box of the 5 embryos or the one baby. What do you take? Everybody takes the baby, of course, which is a great way of kind of saying they're not the same. And anyway, he's done a whole series with pro-choice and pro-life interviews that are very thoughtful. So I'd recommend Ezra Klein.
I think that's a good, excellent recommendation. We'll make sure we include that on the list that goes out of our sources for today. Dana, I'm sorry, we had Dana. Laura?
Yeah, I would just end by saying, we can't allow ourselves to be placated by vague promises of we're going to reduce the cost of delivering a baby and we're going to fund childcare and we're going to create parental leave. Because the same people who are opposed to abortion have had every single opportunity available for decades and they haven't taken it to do those things. And in fact, look what happened with the child tax credit during COVID, right? We lifted children out of poverty and then they pushed them back in.
Yep.
So this won't be that, getting rid of abortion won't be that big a problem, because here's the other things we're going to put in your goodie bag. Let me call bullshit on it. And we need to keep our eyes on the bigger issue of autonomy here.
I appreciate that. And I appreciate you three for helping us have this very, very timely discussion. I'm hopeful that in the fall, in honor of Constitution Day, we can take up some of these issues again, not just abortion, but what might happen to the 14th Amendment. I'm very concerned. I'm very concerned about Brown, just so you know. Why? Because it's a super president. Oh, wait, wasn't Roe a super precedent? So anything is possible here, folks. And I'm not saying it just to be an alarmist. I'm saying this as someone who has studied the Constitution for over 40 years. And what we are witnessing now is not unlike what we've seen before in terms of progress being stopped. And then we have a regression that tries to take us back to a different time. And in my judgment, that the current majority on the court would be happy to take us back to 1950, before I was born. And I'm not happy about that, but that may be what happens. And against that backdrop, it's how best do we continue to uphold those constitutional amendments, which had to be passed by 3/4 of the states in order to be passed, that are interested in things like voting rights for women and those, the 14th and 15th Amendments that also followed the Civil War. So on that note, I am turning the program back over to our Dean, Nancy Aries, and I just want to thank you all for spending this time with us, and the struggle continues. Nancy?
I'll just conclude by adding my thanks to all three of you. I think you just each all added information that even for those of us who thought we followed what was going on, whether it was what was going on with the birth data in the states legally, I think you've contributed to all of us here. So thank you so much for agreeing on such short notice to participate today. It's a real pleasure to have you here at the Marxe School.
Thank you all. And maybe we'll see you in September. Bye.
Thank you. Bye.